Good evening, guys. As I promised earlier, we were going to do a video on cough in children, and today I want to focus more on cough below the age of 5 years. And over the years, what we have seen from parents and what they expect wherever they take their children to the chemists and to hospitals. One of the challenges that we have gotten from parents is that there is expectations that they do have wherever they bring children to us, that if you give different treatment, they really get disappointment, especially if you give certain medications. It has been a challenge, especially if you want to convince a mother that or a parent who has, or a guardian who has brought a patient to the hospital, that is the drug that the baby deserves and not what they expect. Now, I think the public need to understand that different conditions are managed differently, and wherever you take your baby to a medical doctor or a clinician, there are things that we do that you guys don't know before we can make a conclusion on what kind of treatment we are going to issue to your baby. Now, not every cough that a patient has or the baby has guarantees antibiotic therapy. Some of the coughs are just managed, and if you must understand that, in fact, most coughs are caused by viruses, and some patients will come with a cough because they are allergic, and in a few instances you will see coughs that started as a viral progressing to a bacteria due to probably poor immunity from the patient. They are not able to fight the virus out, then a bacteria takes advantage of the immunity of the person and causes havoc, which in this case we will listen, examine, and even auscultate. We use a stethoscope. This one. If you knew the work of this thing and why we use it, then it would be so easy for you. Even when we give you a drug like cetirizine, which some parents find very annoying because every now and then they go to the facility for treatment, they are given cetirizine or Piriton, and they really don't understand why is that so, that every now and then they are given cetirizine. Most coughs in children do not have medication, especially if they are mild coughs, because there's no way you can give an antibiotic to an allergic cough, or as per the presentation of the patient, you are thinking this is a virus, and then you get that you are given an antibiotic. One of the issues that we want you to stop is, because this is the most things that people do without knowing, or some know. Because, for example, some parents will be called by the house girl, and they are told, Madam, Mama so and so, your baby is feeling unwell, or your baby has been coughing the whole day. So instead of you going home, see your baby, check them out. Then if you see the cough is serious, carry the baby, go to the doctor or the nearest clinic or the nearest hospital or health center, or whichever you find nearer to you. You decide now that I'm going to the chemist or the pharmacy that you think is near them. Kindly, parents, stop buying medication from the chemist before the patient has been checked, examined, and a decision made that this patient needs such and such treatment. If you must know, before we treat a patient like a young baby below 2 years or 5 years, and you are complaining, or you are telling us that your baby has been having a cough for 1, 2, 3 days, there's those things that we look at, and there are some kind of questions that are leading questions that we ask you, so that it can give us a whole picture of the condition of the baby. And then from the examination and auscultation, we make a decision that this baby needs such and such a drug. If you see your baby has been given an antibiotic because you said the baby has a cough, we usually classify that cough. And for one to get an antibiotic, we have already established that this baby is suffering from a bacterial chest infection. That's why they are given the antibiotic. But most of the times that you will go to the clinic, but you end up going home with just cetirizine or a steroid, depending on what did we find out. So don't feel bad. And in fact, as a parent, if you feel that the treatment that you have been given is not enough for your baby's condition, it will be better if you ask your doctor about that treatment. In fact, you have an advantage, and you own the doctor. Wherever you go to a doctor for a visit, you own that doctor. You deserve an explanation. You should get clarification on each and every medication you get. If you feel that your baby needed an antibiotic and you didn't get one, it will be prudent if you ask your doctor why your baby did not get an antibiotic, so that you can get a proper explanation. By the time you are leaving, you'll be satisfied by that whatever you have carried home was just enough for treatment. Some of the things that we see here, some of the coughs that we see, in fact, need just home remedies. Remedy number one, mostly, is that we'll tell you to go give your baby a lot of fruits, and a lot of vegetables, plus water. This does not mean that you have not been giving these things. All we mean is, please, on top of what you have been giving, add a little more. Others, we have found, as some of us telling you, or majority of us, we tell you, we ask you some few questions about the environment that your baby sleeps on. What you use to wash the clothes, beddings, and even what you as parents use as perfumes, roll-ons, and even lotions, because there are lotions that you can use, but because your baby is allergic to any little smell, wherever they come close to you, they will still start experiencing a mild cough, which can progress depending on the severity of what is in the environment. So what we mean is, sometimes environmental factors, where the baby schools, if they are school going, where the baby plays, if they play on a dusty ground, be sure that those babies, if they are allergic or they are anything small triggers their allergic or their respiratory system, they will always have a cough, a running nose. And by the way, these coughs are never ending. They are sometimes persistent, on and off. Today the baby has a cough, tomorrow they are doing fine. After a few days of treatment, the cough is still back. And it's always the same cough, almost the same cough. And you can even time it. Anything you time, that should tell you that it's an allergic cough. One of the ways you can time an allergic cough, and that will make you know it's allergic cough. Most of these coughs that you see in children will happen in the morning hours, very in the morning. If they are school going, you see during that time they are waking up, is when you see them coughing, sneezing, and running a nose. So when during the day the weather is fine, sunny, and there's some temperature in the environment, or it's hot, the cough disappears. And in the evening, the same weather has changed, and the climate is a little bit cooler, just like in the morning. You see them sneeze, running nose, even fever, because it's allergic. You will see a baby coughing, especially dry cough. They are sneezing and running fevers, sometimes with red eyes or teary eyes. During morning hours and evening hours. Now, we have got parents who tell you that my baby coughs a lot at night than during the day. This is exactly what we mean as well. Because if it was a bacterial cough, be sure 100% that it will never be timed. Because one, the bacteria is still in the system. Whether in the morning, at night, or in the evening, the bacteria is there. So the cough that comes with the bacteria is persistent throughout, both day and night. And at some point, in fact, if you notice, if it's a bacteria cough, or it's a cough caused by bacteria, this baby will present with difficulty in breathing and other complications associated with bacterial infections of the chest. They will start producing sputum, that is yellow, purulent, that is what we mean, yellow, green. The chest is congested. Even the babies are irritable. They can't play. They are just calm. They don't want to do anything, and they are running very high fevers, because even if you give paracetamol within a short time, the fever is still there. It's when you will know that this one needs to be seen by the doctor. And for your information, I just mentioned, if your baby is having a cough or anything that you think needs medication, kindly take the baby or the person who is suffering to the doctor. Let them be seen, get examined, get checked, and in case there's any lab investigations to be done, let them be done. Plus or minus, sometimes we might require a chest x-ray, depending on how bad the condition of the baby is. So let's learn to stop making decisions ourselves and deciding to go to the pharmacy to buy drugs. And unfortunately, this is one of the things I've noticed. I don't know if my colleagues do, that wherever you go to a chemist, I don't know how this happens, or to a pharmacy, you take anything to them, they'll always give you a drug. And we have seen people who have come to us tell us that nilienda kwa clinic, kwa chemist, daktari, and I was given some drugs I took, but I'm not feeling well. Now, sometimes you might get the drug, yes, it works for you, but it's something they did guesswork. Because no pharmacist or farm tech is supposed to give you antibiotic without a prescription. Something documented and signed from the doctor. Yes, you can buy Panadol. Maybe it's an emergency, you have a very intense headache, you can buy Panadol. For fever, yes, you can buy Panadol. But even Panadol itself, you can abuse it. Abuse. Panadol is a good drug, but if misused, it can cause you serious health problems that you guys don't know. That's why it's given in a limitation. You are told, take Panadol for such and such a period. If the fever or the pain is gone, kindly do not continue taking. And if we feel you should take, it should come from us. That yes, you are still feeling unwell, and this is the drug you still need to continue until such and such a day. So, my topic today touches entirely on babies and cough, and why it is important that we take babies, neonates, 1 year old, 5 year old, 8 year old, to the doctor. And most coughs are self-limiting, meaning they come and they will go by themselves if your immunity is so strong to fight wherever agent or wherever virus or allergy that was in causing the problem. So can we learn to do the right thing? And by the way, paying a consultation fee You might see it as a very expensive exercise, but it can save you a lot of problems and troubles. Now, all people are not the same. And when I say that, economically, I mean in terms of our economical status and how much we get each and every day, we might never be the same. That's why we tell you that if you don't have money to see the doctor in a private hospital or a clinic, kindly do not find an excuse of not taking your baby to a doctor and decide to go to a chemist because you are taking a shortcut, since they will just sell you drugs. Go to even a county or a council hospital, a dispensary, a healthy center there near where you are, or any other level 2 hospital, level 3 hospital, level 4 hospital near where you are. There are doctors there, there are clinicians there. They will check your baby and they will tell you the right treatment for this. We have had conditions that require even admission for management. So take your baby to a professional, qualified doctor who will check, examine, and investigate your baby before they can get treated. Until next time, I wish you well. Good health, and I believe that this is going to help most of our mothers, our young parents, our young fathers, because sometimes you see a baby is left home with the father, the mother is not around, maybe they are the ones working, then the baby starts coughing and the father thinks that the best way to do is to go to a chemist and explain the condition of the baby. Then they are given medication to treat. Young mothers, wherever you have a baby who is coughing, kindly take your baby to a hospital near you. It doesn't matter which one. A private, if you can afford that, or just take the baby to a government hospital near you. Explain to them how the baby has been feeling and they give you the best. Ciao. Have a good night. See you in the next video. And don't forget to subscribe, like, and share. Thank you. Until next time. May God bless you.